Good morning. Today we are going to present our reading report. My name is Giret Marcela Rivera Abril, and my group is made up of Juan Esteban Herrera Riaño, Laura Sofía Vera Guerrero, Antonio Steve Guzmán Mejía y Heider Steve Reyes. The title of the article is Pathophysiology of Acute Respiratory Distress Syndrome and Lung Injury by COVID-19. The journal consulted is Il Silver. Topic in which you register respiratory distress from COVID-19. Subject fundamentals of pathology. This article is to discuss the pathophysiology of acute respiratory distress syndrome (ARDS) and lung injury caused by COVID-19, including the heterogeneity of lung injury, impaired gas exchange, and regional differences in lung density, ventilation and blood flow. Additionally, potential treatment strategies for lung injury caused by COVID-19 are explored, such as the prone position and the use of inhaled nitric oxide and almitrin. The article highlights the importance of understanding the underlying mechanisms of this condition to improve patient outcomes. In summary, the article provides detailed information on the pathophysiology and treatment of lung injury caused by COVID-19 and ARDS. Acute respiratory distress syndrome (ARDS) is a severe lung disease that occurs when the lung becomes inflamed and filled with fluid, and which makes breathing difficult and can lead to respiratory failure. Short biography of authors. Dr. Eric Swinson is an internist in Boston, specializing in internal medicine, adult medicine. He graduated from the School of Medicine in 2015 and has 8 years of experience. Division of Pulmonary and Critical Care Medicine in Massachusetts General Hospital. Dr. Eric Richard Swinson, teacher, Division of Pulmonary Critical Care and Sleep Medicine, Department of Medicine, Division of Pulmonary and Critical Care Medicine, University of Washington in Seattle, USA.
The correct appropriation of the functioning of the capillary alveolar membrane in both normal and pathologic environments is essential when generating a treatment that aims to improve ARDS and lung injury by COVID-19. Goals that must be established for lung injury by COVID-19 must follow the same guidelines that are used in management of ARDS, despite the small difference between the two pathologies. Conclusion is the administration of mechanical ventilation in the prone position in patients with ARDS improve regional ventilation between perfusion heterogeneity. In addition, due to the vascular position in the lung, the prone position improves perfusion, which translates into increased gas exchange.
Acute respiratory distress syndrome does not affect the lung uniformly. The affecting should items. Parents claiming the symptoms and renally found the dorsal region of the lung into the most frequent cause that in tigers are bronchoaspiration, pneumons and walls at cough of extrapulmonary or original are pancreas, septins, peritonitis, polytrauma, cyber and trauma and extracorporate, circular and top. This presumes increase in the player sulfur is not homogeneous because there is lesion is in monohouse parenchyma generates grade 10 or Manchanki's string 10, consequence of which is vascular and COVID-19 long-term injury have similar aspect of reduced and long disability, vasculopathy, alveolar fluid and impaired injury, inflammatory defense and red bloods, thyroid and epithelial cell demand and loss of the normality, alveolar capillary bar and is abated. Domain and drift allow space for gas example for program the injury both mechanical ventilation and possibility and vigorous spawn respiratory effort the factory of the lung insured have import point for life and is hope that might result and functionality outcome.
Contribution of new knowledge. It's the alveology capillary imbalance, leading to a bad gas exchange but physiological to chain and to differentiate lung lesion caused by COVID-19. It is intended to aid physiotherapists since analysis from the pathology to a possible treatment for COVID-19 and ARDS from position the patient for mechanical ventilation to different pharmacologies and rehabilitation for the same.
Then it's time to decide all the questions based on the article. Number one, what is local ventility homogeneity to? Number two, what are the mechanisms that cause the alteration and exchange of gas in the syndrome? Number three, what are the physiological effects they result from the traumatic force of ventilatory support in the lung parenchyma? Number four, what are the clinical features of COVID-19 related lung injury compared of other forms of RS-caused virus?